I'm Dr. Donnie Wilson. I am a licensed naturopathic doctor and midwife, as well as a certified nutrition specialist. And I've been practicing as a women's health expert for over 24 years. And I specialize in helping women with abnormal pap smears. So, a pap smear is what most women know about as the thing you do in your annual exam, right? We go to the gynecologist, and you can also go to a midwife, by the way. In most states, midwives are also licensed to offer women's health care, including pap smears. And so you go in to get this pap smear done, and it's one of those things that is like a screening exam covered by your insurance. But a lot of times you may not even realize what really are they testing for, and what if you get an abnormal test result, right? So a pap smear, what it's doing is it's actually taking a sample of cells from the face of your cervix and right inside the opening of the cervix, what's called the endocervical canal. And usually that's done with almost like a spatula or a brush, a gentle brush that's able to just slough off cells from the face of the cervix and inside the opening of the cervix. And then those cells are taken to the lab where a pathologist can look at them under the microscope. And when we look at cells under the microscope, wherever they are in the body from, we can look and see based on the shape and the size and the coloring, what part of the body are those cells from. It's actually really interesting. I love studying histology, but if you can imagine that every cell in the body has a little bit different look. And so when a pathologist looks at the cells from the cervix and the endocervix, they can tell what a healthy cell looks like. A nice round shape and a small nucleus and a pink color under the microscope. And so they can tell these look like healthy cells from the face of the cervix, what I call the face of the cervix. And or they can see that these are cells from inside the cervix, and they can tell us if they look healthy, or they can tell us if they're starting to look inflamed, if they start to look a little bit like abnormal shaped cells. And there's really a spectrum of abnormalities. So when you hear abnormal pap smear, that's not just one thing. An abnormal pap smear is a gradation from completely healthy cells to a little bit inflamed cells to more inflamed and maybe abnormal shape, and the nucleus is starting to get bigger, and it's looking gradually more and more like a cancer cell. And cancer cells are way at this other end of the spectrum. So I always say that I'm so grateful that we can do a pap smear, that even exists as a screening exam, and I'm hoping technology in the near future is going to make pap smears even more accessible for women, because this is an amazing tool that allows us to identify abnormal cells on the cervix before they turn into cancer cells, hopefully. Now, this progression from normal cells to cancer cells tends to be a slower progression over years, although there are cases where it progresses more quickly. And so we're hoping if we do a pap smear on a regular basis, like every year or every 2 years, depending on your risks and factors in your life, your doctor will tell you how often you need to do it. Your age also it plays a role, and your sexual activity, different partners. That will tell you how often should you check, and if you've ever had an abnormal, you may need to go in more often. And so when you go in to check, you're looking, hey, are there any abnormal cells? If there were previously abnormal cells, have they progressed to more abnormal cells? And the thing is that if it does progress to more abnormal cells, then the gynecologist who's trained as a surgeon can perform a procedure to remove those abnormal cells, remove part of the cervix, or if necessary, if it's spreading, they can do more advanced surgery. If it becomes cancer, then you can go to an oncologist and they can treat the cancer cells, right? So the idea is prevention. We want to try to catch it early. And for me, my job, my role is to help avert that whole situation. I want to help you prevent it from getting worse, and definitely prevent it from going to cancer. Or if you had abnormal cells or cancer, I want to prevent it from happening again. Because as much as the standard gynecological care can help you with removing abnormal cells or treating it if it becomes a cancer, right? They can do surgery, they can do radiation, chemotherapy. That can happen in the standard model of care and likely under insurance if you have insurance. But the thing that doesn't happen under that standard of care is really helping you to prevent it from progressing or prevent it from happening again. And this is likely not what your doctor's going to tell you. They're going to tell you about, likely they're going to tell you this could get worse. They're likely going to tell you come back and recheck it. They're likely going to tell you you might need a procedure. But they're not likely to tell you that there's something you can do to prevent it, like things like diet, lifestyle, nutrients, herbs, probiotics, and so on. They're likely not to tell you that you can take action to prevent it. They're likely not to tell you that your cervix can actually heal. That especially if it's inflammation or what's called CIN1, which is this progression that I'm talking about goes from mild inflammation, or what on a PAP result is called ASCUS, atypical cells of undetermined significance. ASCUS is inflammation, which is one of the initial phases or stages. CIN1 is considered a low-grade abnormality of cells. That the body can heal those things. The body can make new healthy cells in the cervix, and it can heal if it has the right support. CIN2 and 3 is considered more high-grade, more advanced abnormality in the cells, getting closer and closer to carcinoma in situ. Carcinoma in situ is the step before it becomes carcinoma or cancer. So those are the terminology that you might see on your PAP or your biopsy. Now, if you have a PAP that comes back abnormal, like say the PAP comes back and it shows ASCUS or CIN1, then the doctor is likely to recommend a biopsy where they can go in with a specific type of imaging so they can see where likely the abnormal cells are and specifically get a biopsy of those cells, look at those under the microscope, and it's considered a much more specific way to look for abnormal cells on the biopsy. You'll see some of the same terminology, ASCUS, CIN1, CIN2, and so on your biopsy results. And based on the biopsy result, then they can make a recommendation about is a surgical treatment necessary or cancer treatment necessary. But again, some of the things the doctor's not likely to tell you is that even if you need a procedure, let's say a LEEP, or what in other countries is called a LETS procedure, the same thing, it's a removal of the abnormal cells. Even if you do removal of the abnormal cells, even if you do a colonization or what's called a cold knife biopsy, which is removing part of the cervix, or even if you do a hysterectomy, remove the whole uterus and cervix, what they don't tell you is, oftentimes they don't tell you that it could happen again because the surgery or the procedure doesn't kill the virus, right? And 99% of cervical cancer is caused by high-risk HPV virus. This we didn't always know, and now we know. Based on research the past couple decades, it's very clear that 99% of cervical cancer is caused by high-risk HPV virus. So even if you remove the abnormal cells or the cancer, you're not removing the virus. The virus is still living in that person's body, it's still living in your body, and it can cause abnormal cells again. So over and over, I'll see women who had even a hysterectomy, and then 6 months, a year later, end up with abnormal cells vaginally or on the vulva, or it could happen rectally. So this is something they often don't tell you, is there's a risk of recurrence. And that, to me, is really, really an important thing for you to know, because yes, you want to remove the abnormal cells, but that's not a whole solution. We need a much more complete solution to help prevent it from recurring. I know how scary it is to test positive for HPV virus, and I know it's even more concerning when your gynecologist tells you that all you can do is wait and see if it continues and if it causes abnormal cells. That's exactly why, as a naturopathic doctor and midwife, that I feel so passionate about helping women to be proactive about protecting themselves from HPV virus. I've been helping thousands of women for the past 23 years to do exactly that, and to get HPV to negative and stay negative. And that's why I developed the Say Goodbye to HPV online program, where you can get access to my proven protocol from wherever you are in the world. So I hope you will come check out the Say Goodbye to HPV program, review the success cases, and see if this is going to be a good fit to help you get your life back from HPV. Often they also don't tell you that doing these procedures on the cervix, say a LEEP or a LETS procedure to remove abnormal cells, often your doctor might not tell you that it can cause scar tissue. And especially if you have to have repeat LEEP or LETS procedures or cone biopsy, that it can actually cause damage to the cervix that could affect your ability to carry a pregnancy. So I feel like that's really important for women to know, because that also says to me, hey, wait a minute, if we can catch this early, let's do everything we can to prevent it from progressing. Let's do everything we can to prevent it from getting worse, and hopefully avoid the need for those procedures. And even if it develops into CIN 2 or 3, we can consider other approaches. There's a traditional herbal nutrient treatment on the cervix called escharotic treatments that I offer to patients through my office. And it's very successful at helping to reverse these abnormal cells and heal the cervix without scar tissue or damage to the cervix. I've been offering these treatments for over 24 years, and very successfully be able to get rid of the abnormal cells without causing other issues. So if you are currently dealing with CIN 2 or 3, and you're thinking to yourself, geez, I would like to be able to avoid a LEEP or LETS procedure, then please just reach out to my office so we can talk this through and see if this might be an option for you. Because it's something that I've seen help so many women who've been, a lot of times, like I'm thinking of this case, Jessica's case, where she came to me and she had just gotten married and she was hoping to soon have a pregnancy, and went in for a pap smear and found out that she was testing positive for high-risk HPV and had CIN2, and the doctor was recommending a LEEP procedure. And she's like, wait a minute, I don't want to, this is my life path, has been everything what I wanted it to be, meeting my husband, getting married, now getting ready to have a baby. My plan did not include getting HPV and having, potential damage to my cervix. So she was really, and I know many of you could probably relate to this story, devastated. So when she contacted me, we talked it through, and I said that I could show her exactly what I do to help other women, to help her body be able to heal her cervix and fend off the virus. Because the thing that your doctor might not be telling you is that the human body can get rid of HPV. And this is in research studies. There's at least 5 studies more that demonstrate that the human body can clear the HPV virus. In fact, not just sometimes, but 90% of cases completely clear the virus within 2 years. So if we know this in science, then how come our doctors aren't talking about this? How come doctors aren't saying to women, you know what, 90% of the cases, it goes away. So instead, a lot of times, practitioners are telling patients that it never goes away. So if your doctor or somebody told you it's never going to go away, please look at this research for yourself, and you're going to see, yes, it does go away. The human body can clear this virus. And I see it case after case, thousands of cases for more than 24 years. The virus goes to negative, and these women come back to me 5 years later, 10 years later, 15 years later, and tell me that it's still gone. So if that's the case, then any doctor that's telling you that it's not going to go away is incorrect. It can go away. And any doctor who's telling you that all you can do is wait and see is also not giving you the full story. You can do much more than wait and see. Wait another 6 months and see if it gets worse? Wait 6 months and see if it becomes cancer? Do you think that's what Jessica was not willing to do that. She's like, I'm not going to wait 6 months. I'm ready to have a baby. I don't have 6 months to spare and wait around and see if it's worse. No, thank you. I'm not signing up for that. And she instead worked with me and we implemented my protocol. I'll tell you more about it here in a minute. And sure enough, she was able to heal her cervix completely without scar tissue, without damaging her cervix, and clear the virus to negative. And then I helped her to get that healthy pregnancy, that healthy baby, and achieve her dreams. What she wanted was creating a family with her husband, and she was not going to let HPV get in the way. But that's not something she heard in the doctor's office. That's something she heard from me in my office. So I really want all of you to know this information that your doctor's not likely to tell you. That they're not likely to tell you that your body can actually heal. The cervix can heal. You can take steps to support your body. There are actually mechanisms within the human body that protect us from the HPV virus. More than one mechanism. Yeah, we mostly would think about the immune system. Yes, that's an important part of it. The immune system can make antibodies against a virus. Yes. Our immune system is also depleted by stress and toxins and nutrient deficiencies. So how is our immune system going to protect us when we're so depleted? We need to build your immune system back up again. Not only that, but our microbiome. We have a vaginal microbiome, and part of its job is to protect us from infections like HPV. But the vaginal microbiome is disrupted by sex, by spermicide, by antibiotics, and many other things that can disrupt the vaginal microbiome, including the gut microbiome. If the gut microbiome is off balance, it throws off the vaginal microbiome. And if you've had any history of BV, yeast, or other vaginal infections, then we know your vaginal microbiome is disrupted. No wonder that HPV shows up. And then when HPV shows up, it further disrupts the vaginal microbiome, making you more susceptible to it, right? HPV is smart. It's going to create the environment that serves it. But we have to outsmart that virus. We have to outsmart the virus by saying, wait a minute, this is your vaginal environment. You get to support the microbiome. You get to kick out the HPV. And you can do that when you have the right information. But that's not likely what you're going to hear from the doctor's office. They're not likely to talk about how do you restore your vaginal environment. Even though it's well established in the research, it's just not integrated into standard of care. So it's one of these things where you're likely going to have to step outside the box of standard medicine. And you're going to have to take this into your own hands. And you're going to have to say, wait a minute, I'm not willing to put my dreams and my future on the line, hoping that this virus is not going to cause cancer. I'm going to put all of my focus and my attention and my intention on helping my body clear this virus, because I know the body can, the human body can. We just need to figure out why is your body susceptible to it? Again, do we need to help your immune system? Do we need to help your microbiome? There's several other factors. How's your hormone levels, estrogen, progesterone, cortisol, insulin function? These all play a role in our ability to fend off HPV. How about your stress from the past? Do you have stress exposure, trauma exposure? These things make us susceptible. But we can also heal from stress and trauma. We can learn how to reset our nervous system, and not just in a mental mindset way, but we can actually reset the nervous system by using herbs and nutrients that reset cortisol level, adrenaline level, serotonin, dopamine, GABA. These are the messengers in our nervous system that help us be resilient to stress. And by being resilient to stress, we can be resilient to HPV. So this is to give you a sense of some of the factors that I guide you to look at. Gut health, hormone health, nervous system, immune system. When we look at these factors, and sometimes we need to do some specialty tests to understand exactly what it is for you. This is testing that's not available most times through standard labs. So we need to do specialty labs to say, okay, do you have leaky gut? Are certain foods causing inflammation? How is your vaginal microbiome? How's your estrogen, progesterone, liver detoxification, right? We need to test these things to know where are the issues that we can then address using diet changes, nutrients, herbs, and safe, effective doses individualized to you to help you clear the virus. And you're not likely to hear this from your doctor's office. They might say, oh, take some folate or take some green tea And yes, there's research on folate and green tea, and I love both of those. I include them in my protocol. But a lot of times that's not enough. That's not enough because it's just two things that are giving you a little edge over HPV. It's better than nothing. But what I find is in really persistent cases, like I'm working with cases of women who've been battling with HPV for more than 10 years, have had recurrent infections, recurrent abnormalities, even cancer that has recurred. And when I'm working on those kind of cases, I have to think beyond a couple supplements. I have to think big and comprehensive and really understand, how do I help you protect yourself from a virus that's taking advantage of the situation? I have to be a detective and figure out exactly where is it sneaking in, and how do we patch up those holes so the virus can't sneak in anymore, and you can now protect yourself from the virus. So this is what it starts to look like when I work on a case and start to see that it's possible to heal from an abnormal pap smear. It's possible to use natural remedies to address cervical dysplasia. Cervical dysplasia is the medical terminology for abnormal pap smear. So if you hear cervical dysplasia, that's the same as saying abnormal pap smear. It's the same as that gradation from inflammation to cancer. It's called a dysplasia. Dysplasia is when the cells are looking more and more abnormal, right? So the cervix and abnormal cells is cervical dysplasia. That's what that means. And there is treatment for abnormal pap smear and cervical dysplasia. There's a treatment, and the treatment is to use a comprehensive protocol based on understanding your individual susceptibilities. What is it that's allowing this virus to take advantage of your self, your body, your home, your environment? And you get to take charge. This is your body. This is your vagina. You get to decide. This is your life. You get to say, hey, wait a minute. This virus doesn't get to take control and put me into a state of fear and anxiety and stress. I'm going to take charge, and I'm going to get the information I need to change this situation, because I can tell you that case after case of women who have done that have been able to heal themselves and have been able to set themselves free. Women of all different ages, from 20 to more than 70 years old. I work with all different ages, because this doesn't just happen to women at a certain age. This happens to women of all different ages. Ultimately, most all of us, 80% of us, are exposed to HPV virus by age 50. And it's not just something that happens when women have multiple sexual partners. It happens even with a single sexual partner, and it can happen at any age. Sometimes women contact me when they're in their 30s, their 40s, their 50s, their 60s, their 70s, and all ages. And no matter how long you've had the virus, I've been able to help clear it. And no matter what type of HPV, I've seen every different type, and some women with more than one type of HPV, because you know what? When we outsmart this virus and we come at it with a comprehensive plan to get your body in tip-top shape, doesn't matter what virus strain, doesn't matter what age you are, you can protect yourself from this virus. You can kick it out of there, and you can say, listen, this is my body, you're not coming back. Even if you're re-exposed to the virus, it will not come back if your body's ready to protect you. So before you consider another procedure, another surgery, before you let the fear from the gynecologist take over in your mind, I encourage you to take this video and then follow up. Find the link down below to get in contact with me and set a time to talk with me or someone in my office on my team about your case, and say, here's my situation. Can Dr. Donnie help? And we will help you to know exactly what we suggest, what we see based on experience, based on the cases I've worked with, what other women have found. I mean, we have a greater than 90% success. And that really is to say that every woman who steps up and follows my protocol and does exactly as I suggest has been able to clear abnormal cells, clear HPV to negative, and prevent it from coming back again. And the only times that doesn't happen is when they haven't been able to fully implement the protocol, and or if they were under a huge amount of stress again, and it sets them back and their system is susceptible again to the virus. But as long as I can get you to address all the underlying factors that are making you susceptible and really help you to understand what you need to do going forward to take better care of yourself, you're going to be able to prevent the virus from coming back again. So I'm so glad you joined me here today. Make sure to subscribe, like the video, subscribe, join me for the next video. All right, I'll see you soon.
Thanks for listening to How Humans Heal. If you liked this episode, leave a rating and a review. And for more resources, visit drdonnie.com.